स्वस्थ समाज का निर्माण करना है तो हमें होलिस्टिक सोच के साथ काम करना होगा। साथियों, आयुष्मान भारत योजना इसी सोच का परिणाम है। तो आयुष्मान भारत ने गरीब से गरीब व्यक्ति को बेहतर स्वास्थ्य का विश्वास दिया है।
Prime Minister Modi, I look forward to working with you to make our nations even more prosperous than ever before.
इस बात का यहाँ पर मखौल उड़ाया कि ये इतना बड़ा रिफॉर्म कहाँ से हो गया। मैं अभी आपको फिर बताना चाहता हूँ कि जब इतिहास लिखा जाएगा तो नेशनल मेडिकल कमीशन को नरेंद्र मोदी जी की सरकार के एक बड़े रिफॉर्म के रूप में देश में रिकॉर्ड किया जाएगा। और आज का दिन जब आप इसको बिल को पास करेंगे, ये भी गोल्डन लेटर्स के अंदर लिखा जाएगा। आज हो सकता है आप इसका मखौल उड़ा सकते हैं, लेकिन भविष्य जो है उसके गर्भ में क्या है वो आप सब हम सब मिलकर देखेंगे।
Presently, our country seems to have slowed down somewhat. The rate of growth of GDP is declining. The investment rate is stagnant. Farmers are in distress. The banking system is facing a crisis. Unemployment is going up. We need a well-conceived national strategy to make India a 5 trillion economy.
A Congress government in 2019 is dramatically going to increase the amount of money we put into healthcare and education. We are not going to put money in ways that allow limited number of people to make massive amount of money. That is how I view the Ayushman Bharat scheme.
जब से उन्होंने बोलना सीखा है और बोलना शुरू किया है, मेरी खुशी का कोई पार नहीं। 2009 में पता ही नहीं चलता था कि भाई इस पैकेट के अंदर क्या है, पता ही नहीं चलता था। अब पता चल रहा है कि भाई ये है, ये नहीं।
Prime Minister of India can go and visit foreign countries and discuss about various issues, sign MOUs, discuss defense deals, discuss various other factors that actually come into the governance and the style of functioning in India. But has Prime Minister Modi missed the bus? Did he realize it is equally important that healthcare is the most important factor, so also the defense?
Global healthcare is at the frontier of change. Health is serious business. Healthcare delayed is healthcare denied, and India needs to ensure affordable and accessible healthcare to all at all times. More than saving human lives, humanity needs to be saved in India. If every citizen of the country is considerate of this simple rule, all other perils of the healthcare ecosystem in India shall slowly but surely be solved. A big hello and welcome to the iconic and historical annual edition of Pharma Leaders' 12th momentous year, where the focus is on patient care and looking beyond the headline. Against the above background, Pharma Leaders, nation's pioneer media in healthcare communications, with close to 2 decades of understanding the healthcare landscape in India, is organizing the most awaited and iconic 12th Annual Pharma Leaders Summit and Awards 2019 under the theme Healthcare Innovations Beyond the Headlines. Pharma Leaders is an independent media house that voices the opinions of the key stakeholders of the country in an independent and unbiased way. We are unafraid and unmoved when it comes to truthful reporting, as we feel we have a responsibility to tell the world the story as it is. We are independent. We are bold and restless. We are not there to please or displease the authorities, but to present facts based on our strong research and ground reporting. Addressing a high-level meeting on universal health coverage in New York recently, Prime Minister Narendra Modi said that his government, having a clear focus on health, has taken historic steps to ensure affordable health for all. World welfare begins with people's welfare, and health is an important component of it. And in line with this global principle, India is laying great emphasis on health, said Modi. India has adopted a multi-sectoral approach towards the health sector. The country is focusing on 4 main pillars of universal health. These are preventive health, affordable healthcare, supply-side interventions, and mission mode intervention. Access to not just a disease-free life, but to a healthy life is the right of all people, and for this, the responsibility is on the government and social institutions to prepare and provide required services. Ladies and gentlemen, known for championing the cause for healthcare innovations and raising serious discussions to pave way for a better healthcare by bringing together the finest brains of the healthcare industry under one roof, Pharma Leaders today is India's most credible and prestigious title and a senior leader in healthcare communications. Backed by more than decades of experience while working with the stalwarts of the industry, Pharma Leaders has always preferred uniqueness of the subject that appeal to the nation and are first of its kind in contents due to our in-depth expertise, research, and Pharma Leaders' reputation over the years. Speaking on the healthcare, Satya Brahma, Chairman and Editor-In-Chief of Pharma Leaders, opines that even after 7 decades of independence, it is unfortunate that health has remained an issue that isn't paid much attention to in India. The primary reason behind poor health profile of an average Indian is the abysmal public health scenario. Low and regressive public health investments in preventive, promotive and curative healthcare facilities have been plaguing India's public health sector for ages now. Ladies and gentlemen, Pharma Leaders is of the opinion that there are 2 sides to every coin. Low government expenditure is only one side of the problem. A greater problem that most certainly has a negative impact on the health scenario in India is the prevalent poor quality of public health facilities, especially primary health care, primary health centers and community health centers. Health inequalities is another critical factor here, stultifying the growth and progress made in the healthcare domain, if at all. Due to high relative income inequality and poverty, the poor have to depend on the inadequate public health facilities vis-a-vis expensive private healthcare facilities in the country. This is not so straightforward since the poorest of the poor receive fewer benefits from the public health system than their better-off counterparts. So in essence, the Indian healthcare sector grapples with twin issues: healthcare unaffordability and healthcare inequality. Thus, the lack of reliable public healthcare services and the absence of health insurance further compel the poor to depend and spend heavily on the only alternative available, that is, private healthcare. This translates to the high proportion of out-of-pocket expenditure (OPE) on health. High healthcare costs often lead people to delay treatment, aggravating health problems. Lastly, medical negligence, corruption and laxity on the part of a few medical professionals staff workers and other personnel in the public health ecosystem must be brought to justice. The government must also be accountable. Politicians and ministers cannot just get away by launching inquiries, setting committees and condemning such careless acts in the medical field. There must be greater democratization of health issues via increased participation of medical doctors, citizens, media and the judiciary alike. Ladies and gentlemen, National Health Mission (NHM) is the Indian government's largest public health program. It consists of two submissions, National Rural Health Mission (NRHM) and National Urban Health Mission (NUHM). The budget allocation for the NHM has been increased by 9.51% in the current fiscal year from Rs 30,129.61 crore in the budget estimate for financial year 2018-2019 to Rs 32,995 crore. However, this allocation does not cater to just NRHM and NUHM. Out of the allocation for NHM, Rs 8,405 crore, that is, 25.47% of the funds cater to tertiary care programs and human resources for health and medical education. The allocation for NHM as a proportion of total health spending has been continuously declining since 2017. The health and wellness component of the Ayushman Bharat scheme is also routed through NHM, so it further affects the allocation for sub-centers, primary health centers (PHCs), community health centers (CHCs), sub-divisional hospitals and district hospitals. Our political leaders, media, citizens, you and me need to question the regrettable state of affairs plaguing the Indian healthcare system. Ladies and gentlemen, the healthcare industry in India has been one of the country's largest economic sectors with regard to both employment and revenue. Indian healthcare sector is expected to record a threefold rise at a CAGR of 22% during 2016-2022 to reach $372 billion in 2022 from $110 billion in 2016. India ranks 145th among 195 countries in terms of quality and accessibility of healthcare. There is immense scope for enhancing healthcare services penetration in India, thus presenting ample opportunity for development of the healthcare industry. Indian healthcare industry is one of the most knowledgeable and professional industry in the world. India is the only country with largest number of US FDA compliant pharma plants, more than 262 including APIs outside of USA. We have nearly 1,400 WHO GMP approved pharma plants, 253 European Directorate of Quality Medicines EDQM approved plants with modern state-of-the-art technology. No other country can boast of such an infrastructure. Indian pharmaceutical industry supplies over 50% of global demand for various vaccines, 40% of generic demand in the US and 25% of all medicine in UK. India accounts for 20% of global exports in generics. India's pharmaceutical exports stood at $17.27 billion in 2017-18 and are expected to reach $20 billion by 2020. In 2018-19, these exports are expected to cross $19 billion. Indian pharmaceutical sector is expected to grow at a CAGR of 15% in the near future, and medical device market expected to grow $15 billion by 2025. India is the second largest contributor of global biotech and pharmaceutical workforce. The pharmaceutical sector was valued at $33 billion in 2017. Indian pharmaceutical companies received record 300 generic drug approvals in USA during 2017, where the generic market is expected to reach $88 billion by 2021. By 2024-25, India's biotech industry is estimated to increase to $100 billion. As per industry estimates, the Indian medical devices market will grow to $50 billion by 2025. Currently, India is counted among the top 20 global medical devices market and is the fourth largest medical devices market in Asia after Japan, China and South Korea. Pharma Leaders believes that when there is an enormous shortage of public hospitals, when state expenditure on healthcare is abysmally low by any international yardstick, tax money should be used to set up public hospitals. That's what we must do.